Hello, everyone. It's great. Can you guys hear me okay? Perfect.
Yes, we can.
Great. It's great to see many returning viewers. For those that are new, my name is Caitlin Conway, and I am a chronic disease and patient and family engagement lead here at Mount Pacific Quality Health, whom I've been with since 2016. Thank you for joining us for today's session, Identifying and Controlling Hypertension, What Works and What Does Not, where we will discuss gaps, barriers, and solutions that facilities and patients are currently experiencing. I would like to welcome back our presenter today, Stevie Tsai. Stevie has been with us since 2017 and has been leading projects throughout our region working to improve health outcomes. Stevie is a registered pharmacist and has over 14 years of experience. Stevie, we are ready for you to kick us off.
Awesome. Thank you, Caitlin. And thank you, everybody, for taking time out of your day to be with us. As Caitlin mentioned, we are going to talk about how to identify and then control hypertension, primarily in an outpatient clinical setting, but you can also apply a lot of this learning to other care settings. So that could be specialty clinics or even in the hospital setting, because we'll be talking about ways to engage patients and education strategies. Just a reminder of our objectives. They are the same for our 4-part session. So we're going to continue talking about COVID-19 related events, best practices around hypertension identification and management, and then working on some of those quality improvement projects, as well as engaging and empowering our patients and fostering their participation as part of the healthcare team. Just as a reminder, Mountain Pacific Quality Health serves an area primarily in the Rocky Mountain region and then also in the Pacific. We work with Montana, Wyoming, Alaska, Hawaii, and then the Pacific territories, which include Saipan, Guam, and American Samoa. So we appreciate everybody joining us from our region. And please, if you are in those states and would like to work with us closer, reach out to us throughout the series, or if you're not located in our region, you can still give us a holler and we will help connect you with resources local to you as well. To kick us off, several of you helped pitch in with some of our evaluations from our first session and included giving us some really great questions around hypertension and hypertension control. So we wanted to spend just a few minutes addressing a select few of those questions. And then I wanted to let everybody know that more information will be coming out. There is purpose behind asking you for your feedback, and so we do want to give you what you want from that. So as you're sitting listening today, please feel free to jot those questions down. You can either pop them into chat to the panelists, or you can send them to us on our end of session evaluation. So Caitlin's going to hop on here and we're going to chat just a little bit about a couple of questions from our first session.
Thanks, Stevie. Like she said, we had a number of questions, and so we're only going to be able to answer a few live right now, but we'll send follow-up for the additional. So the first question that's posed is, who supplies home blood pressure kits?
Yeah, and so this is a really common question. We all know resources are limited in any healthcare system, and getting some of these programs up and running can be expensive. So there are several options to getting your home blood pressure kits set up and going. One would be to purchase it as an organization if you have the funding to do that. But often there are also local resources, either through local or state grants or programs that are helping reduce the number of uncontrolled hypertensive patients. So like, for example, in Wyoming, we have the ability through our CDC 1815 grant work, which helps control high blood pressure, to provide participating clinics with a handful of those kits. And those types of programs occur sporadically throughout the nation. And so there are definite resources out there to help your clinic get those kits set up. It's harder in the time of COVID because we're not able to share those across patients without really good decontamination protocols. So another option is to help patients pick from a list of recommended verifiable blood pressure monitors. You can often get patients started at home for less than $50, and that's often a price point that patients can afford. So those are typically where we have clinics start.
Great, thanks, Phoebe. So the next question, how do you best approach other community resources in order to better coordinate care?
So this is where we're going to plug just a little bit of our Mountain Pacific work. In most communities, you will find some quality improvement coalition work going on. Mountain Pacific has the opportunity to support that across our region. There are other Quinn QIO programs that are doing that in other states. We do cover the whole nation, and that's a really great place to bring together some of those stakeholders to talk about needs, and it allows you to work together in a really coordinated system to work through some of those like task workflow issues, misunderstandings, developing policies that work across a wide variety of settings. I would really recommend looking for those community coalitions in your area and bringing together whoever you need to the table. Sometimes you do need to invite them, but typically we find that most people are anxious and ready to solve these problems if you come to them with a clear need and then a good understanding of what you need from them and then what you could offer them in return.
That is wonderful. Thanks, Evie, for sharing that. And the last question we have is, what are some patient education tools you recommend and how best to get them to folks virtually?
Yeah, so this is a place where we're experiencing a lot of changes in this time of COVID and this current pandemic. Traditionally, we would have pamphlets and printouts and things available in the clinic, and those are still good if you have a patient right in front of you. But we're also seeing this really nice explosion of utilization of online tools and resources. More and more of our patient population is getting comfortable getting on the patient portal, receiving emails from their providers, doing secure messaging. And so it's a really good opportunity to look at what you have available through your electronic health record or through your system so that you can do a lot of that outreach. There are also other non-traditional things you could try. We find that Facebook is a great avenue to reach out to new people and educate on different things, and it's usually pretty cost effective. So you can start folding in some of those social media things. Patients of all ages are utilizing technology more than ever right now. And you can even start pulling them into telehealth and virtual sessions. We're finding that most patients are really receptive to that new communication. And so this big time of change is actually removing some of those barriers to using electronic communication. So I would encourage you, like I said, to go back, look at what you have in your electronic health record, see who do we have emails for? Can we include that as part of our registration process? How do we get people pulled in and trained on our portal so that you can really make sure that you're maximizing those efficient ways of communicating? And then on the back side of that, you would like to have some empaneling done where you can identify patients who have certain conditions so that you can identify who's on that list and send them some of that targeted education. And it looks like we've got a couple questions in chat. As far as 1815 funds, I would suggest you reach out directly to your representative for your area. It goes all kinds of different ways. Some directly provide the BP cuffs to the clinics, others are loaner programs. So it's really dependent on your local resources. And then I see that telehealth has said within our EHR, we can send patient handouts through our portal system, and they recommend that to other clinics who utilize the portal. And I agree. Patients value feedback that they perceive is from their provider. They will read things from their provider more often than all the rest of the healthcare team. They tend to key in on those things. And so if you have a way to make it look like it's coming directly from their nurse practitioner or PA or their physician, those are great ways to engage patients and give them little nuggets of information. So that's a little snippet of what we have As far as questions, there have been a lot of really great things about specific resources, and more of that information will come out electronically to you. So moving on, we're going to touch briefly on our regional COVID-19 updates. And there have been a lot of changes in our region here. So we've got Alaska, who interestingly, after the long weekend, didn't have any new cases to report as of 9/7. That's likely because of a data gap or lag, not because there are truly no new cases. They did have 95 new cases as of 9/5. They're up over 500 active cases versus 2 weeks ago when we last met. And all of our states have added significant numbers of deaths in those 14 days. So Alaska is up 10 deaths in that time period. Guam, where we were having really a large surge, like a concerning number of new cases, is seeing that taper off, largely because they are doing a great job implementing social distancing, reinforcing hand hygiene, and keeping people home and isolated when they need to be. And that is helping their number of new cases taper off, but we are definitely still seeing an upswing in those active cases total because it does take a while for people to clear the virus and be considered inactive. During that time, we've lost 12 people. Hawaii is in a similar situation. They are having a slowdown of their new cases, again, due to increased social distancing measures, stay-home orders, those sorts of things. They have the largest number of active cases, which makes sense because they have highly populous areas, but they've also lost several people in the last 2 weeks. Montana and Wyoming are very similar, so I've got Montana here for you, and I'll show you Wyoming in a moment. But we're seeing sort of a steady incline in those states in the number of new cases. Small numbers because of the small population, but it's still significant in the cases per 100,000. We are definitely adding lots of active new cases. And that number is important to keep in mind because that's the number of people that we've identified that have been out in our community that are possibly spreading the virus. And that's where things like masking protocols and ability to really follow our social distancing guidelines are very important, because also interestingly, throughout different geographic regions, people's ability to follow mask guidelines is very variable. And so as we have more active cases in an area that's maybe not masking as well as we would like them to in the public health world, we see that increase of transmission. So that's definitely a factor in our Montana and Wyoming communities. Northern Mariana Islands still has a good handle on their COVID cases. They did have one new case as of yesterday, but they are continuing to keep that well under control. Good adoption of those universal precautions that reduce transmission. And then Wyoming, again, we're slowly seeing that uptick in the background for all of these states as well. They're also monitoring hospitalization, and winter has officially set in some of our Rocky Mountain communities. And so we'll be watching closely to see what happens as people are less able to spend time outside and spending more time indoors, with the backdrop of influenza as that kicks into gear as well. With that, I'm going to turn it back over to Caitlin. We're going to have this little snapshot of patient perspectives, and she's going to tell you a little bit about our patient perspective today.
Thanks, Phoebe. It's important for us to do checkups and check-ins with our patients. Patient and family voices and experiences shape the work we do to create a patient-centered healthcare system by doing a number of things, including supporting two-way education between patients and families and the healthcare system, and patients taking the ownership of their care. Patient and family advisors serve in a variety of healthcare settings, sharing their personal stories to represent all patients and families. They provide an educated perspective of care by bringing authenticity, empowerment, respect, and inspiration to the design and delivery of healthcare systems. Here at Mountain Pacific, we are lucky to have 13 patient family advisors from across our region to share their unique ideas and experiences. They have been integral in improving the processes we use and share here with our greater communities. Recently, we were able to sit down with one of our wonderful advisors, Diane Luck, who is willing to share her experience during the current pandemic. We are very thankful for her time and story. Stevie, can you please share the video showing the patient pandemic perspective?
There we go.
I can't manage my health care the same way I did a year ago. I'm used to going to exercise classes, having coffee with the girls afterwards, chit-chatting, going to the senior center and doing things like that, and that's been shut down. I have hypertension and my husband has respiratory, so we are very cautious and try to be very mindful of mask and distance and things like that. You don't feel confident. You don't know what you're walking into. It's an uncomfortable situation. Am I safe? Am I not safe? Should I go? Should I not go? Healthcare protocol for office visits is all over the map. On one visit, they were spot on. They were A+. I get anxious when I get ready to go to the doctor because I just don't know what I'm facing. I have to be aware anytime I step into an office, whether it's a healthcare provider, the grocery store, whatever, I have to be aware of what situation I'm walking into. I don't feel safe going back to the doctor. The information is so mixed up that I don't feel like I can trust any information, from healthcare providers to the news to articles that you read. You just have to take a combination of all of it, analyze it, and do what you think is best for you. I have been a caregiver, am a caregiver for my husband, and communication is so important with the healthcare providers that I became involved with this organization. I'm a patient and family advisor for Mountain Pacific Quality Health.
So with that from Diane, you can really hear how confusing that things can feel in this current climate. And we've been able to have several conversations with lots of patients, and then also do some reading. There are some good patient testimonials that you can find in lots of different outlets that talk about how confusing it is to access healthcare right now during the current pandemic. And we've got a little word chart here just to talk about the different things that bubble up with patients. People really tie staying home with staying safe. We know that patients are not accessing healthcare at the same rate or in the same ways that they did prior to the COVID-19 pandemic. There is this perception that, yes, their chronic condition is serious, but the risk of getting COVID-19 is possibly worse than that chronic condition. And there's a lot of fear that seems to be driven from a lack of understanding and that sense of I don't have total control over everything that is happening around me. So that presents a lot of really great opportunities to the healthcare team to talk about standardizing the COVID-19 approach and the safety protocols that we put in place across our community or our healthcare settings. Many of our clinics have multiple locations, so it gives us that good opportunity to just make it the same across the board so that patients feel like they know what they're doing wherever they go. I know that that has been a repeat thing that we've heard from some of our advisors and then our Medicare beneficiaries in our communities, where there's that uncertainty of what's safe, what's real, what's not. And we can really help fill that gap, especially if we're using that electronic communication, sending people prior to an appointment. This is how you check in. This is what that process looks like. A lot of places are now asking patients to telephone before they enter a building, to utilize telehealth if they have concerning respiratory symptoms, and just letting people know that either when they schedule their appointment or a day or two before they're supposed to go in as part of a pre-appointment check-in is really helpful, and it allows them to feel more confident accessing the system. Was a really good article out recently as well that came from oncology, where some patients feel that this abundance of caution is increasing the safety in our environment. And so remember that the way we impact these changes in our current practice settings can really set the tone for patients. We have this opportunity to be welcoming and supportive and consistent in a way that can make this a positive experience for many patients, because more and more you're hearing from healthcare providers this growing concern, because we know patients are not accessing the healthcare system when they need to be, and that is a fear-based issue currently. So, oops, sorry, having some computer issues. There we go. So talking about hypertension quality improvement, we really want to dig into getting to the goal. As quality improvement people, we like to promote different ways to evaluate that. So here's just a little snapshot of suggested ways that you could measure a quality improvement program that you implement in your setting. That can either be payer-driven, or it can be clinic-derived measures. So it just depends on what's important to you and what you have access to. This can be as simple or as hard as you want to make it. You can use a registry. You can impanel patients and really dig into your EHR and make it work hard for you and have great reports. Or you can do things like spreadsheets and checklists and just know how many patients you have that you're impacting a certain way, and then measure whether or not you're getting the results you want. So there's a lot of flexibility when you're looking at how well a program that you implement is working for you. You can't talk about hypertension without also talking about checking blood pressure correctly. I was chatting with some of my colleagues earlier today about our different experiences having our blood pressure checked in clinic settings. And I happen to access the healthcare system frequently, and I cannot remember a single time this year where my blood pressure was recorded in the way that is recommended, where I'm given 5 minutes to sit, I keep my feet flat on the floor, no one's asking me to speak while they're checking my blood pressure. And so this is really the very first opportunity to improve blood pressure measurement in your clinic setting and get more people to goal. We can't create good goals if we don't have nice evidence and validated results to talk to patients about. And so this is where I always recommend people start when we're talking about hypertension. Be sure that those staff members that are rooming patients understand the importance of this and receive training and are checked off on blood pressure measurements annually. It's a very simple thing to do. You can also educate patients on this, provide some of these flyers. This particular one is from the American Heart Association, so that patients know what they're supposed to do as well, because that way they have that opportunity to say, hang on, I'll answer that in a moment. I'm going to sit here so we know what my blood pressure really is today. So that's a great place to start. And then our next place that we like to go is self-monitored blood pressure programs. And these are a great way to help engage patients into developing their goals and outcomes and desires around hypertension. We call hypertension a silent killer because most people don't know that they have it when we put them on medication. They typically don't feel as well as they did prior to starting that medication. So there are a lot of incentives to sort of miss blood pressure from the patient perspective. And then from the provider's perspective, we're busy. Not everybody wants to be engaged in this care. It's hard to convince people that this is an issue and pull them into care. And a self-monitored blood pressure program is a very cost-effective way to help engage patients in their care and really get them on board to where they understand their disease state, they understand what the risks and benefit of treating their hypertension is, and it's relatively simple, assuming you have the staff, to put into place. So the way that you do that, this is just a simple 3-step overview We do have affinity groups that we offer at Mountain Pacific Quality Health around self-monitored blood pressure programs, where you work with small groups with clinics or other care settings similar to your own, where you work with an account manager to help implement a protocol and a program in place for your clinic so that you can roll this out. We are getting ready to start more of those at Mountain Pacific, so if that's something you're interested in, we'll be polling for that later. But you just go in, you prepare your care team through training, you identify who those team members are, you work on your clinical support system. So find an existing model that works for you, develop a feedback loop so that you can ensure that you are helping address things as they come up, and then empowering patients. The data is very, very good from these programs. Patients like them. It does get them more engaged in care. We do see a reduction in their blood pressure. We see large percentages of increases in getting patients to goal. And we do that in lots of different ways. Part of it is just teaching them how to take their blood pressure at home and enabling them to do that. But also it is an opportunity for some one-on-one guidance and education with patients so that they understand their very specific reason for treatment. So that SMBP program is defined as regular measurement of blood pressure by a patient outside of the clinic setting. Usually it's for a defined period of time. We often start with about 30 days of monitoring. So it's not a huge time commitment for patients, but it really teaches them through a supportive program throughout that time period how to keep track of their particular well-being and then when to ask for more help. It also provides this additional patient support, like one-on-one counseling, usually with an identified well-trained person in your clinic setting. It does not have to be a provider. This can just be someone who is passionate about blood pressure in your clinic setting, who is trained and knows when to escalate to another person. And you can provide educational sessions. Right now, these would typically need to be virtual, but there are a lot of platforms that you can use to make that happen. There's Skype, there's Zoom, Google Meet, all of those things are available, where as long as you're not sharing patient-specific information, you could do some of those education there without the concerns of HIPAA and those sorts of things. And then there's a ton of electronic or web-based tools, and we'll be sending out some information on what some of those are. They're available from lots of well-known organizations nationally, either from electronic health records or from people like the American Heart Association, the Million Hearts program, all have different web-based tools that they recommend. And again, we're getting more and more people plugged in to electronic resources, so that allows them to move forward with that. The other thing we're going to touch on briefly here is talking about team-based care. This is a great way to involve your whole care team into getting people on goal. So there's a brief outline there that you can look at, but the most important thing is to get a patient-centered culture going in your clinic so that you can have role flexibility so that that team is well trained again. You can implement things like chronic disease management, the self-monitor blood pressure, so that people really feel like not only do they have the ability to say, I'm going to take this on as the right thing to do for this patient, but also I have that ability within my organization, and I know I'm going to be supported by the other people on my team as I make those decisions. We do have a couple of polls. Maynette, would you mind throwing up the first poll, please? We're just going to gauge some interest on whether or not people would like to know more about self-monitored blood pressure programs. And depending on your response, we will reach out to you and let you know if we have an affinity group starting up in your area, what electronic information we can send to you, and how we can best support you. Whenever you're ready, Maynette, we can close that. Wonderful. So it looks like lots of people would like more information, so we'll be sure and send that out. And if we could please start the second polling question. This is about team-based care and just looking to see who might be interested in more education and training around team-based care to improve hypertension in their practice. Wonderful. This was a fast and furious 30 minutes today. I appreciate everybody hopping on. This is just a very brief overview of some of the programs that we recommend for quality improvement around hypertension in your clinic. We will reach out to you based on the results of these polls to talk about what next steps might be for your practice site. And then as always, at the end of the slide deck, which will go out to all participants, we have a lot of references and resources for you. So many different opportunities for provider toolkits to improve hypertension, and then lots of patient-facing resources and references to help engage patients in those as well. Please feel free to reach out to Caitlin or myself if you have any questions, and we look forward to your feedback.